If you are old and masturbate, you cannot miss this video. If you are a mature gentleman and engage in self-pleasure, I have a question for you. Have you ever considered whether it remains healthy beyond the age of 50 or 60? Or perhaps you've privately contemplated whether your actions might be leading to some unseen consequences. You are certainly not the only one experiencing this. This subject is often clouded by misconceptions, old beliefs, and a noticeable absence of accurate, trustworthy information. This is a prevalent, though often overlooked, issue for men as they age. Upon reviewing the available data, it becomes clear why there is considerable uncertainty surrounding the issue. Research indicates that although most men over 60 engage in self-pleasure, many do so without full awareness of the potential impacts on their hormones, prostate health, or even their performance with a partner. That's why today we're going to engage in a straightforward, evidence-driven discussion. Let's explore 10 unexpected advantages of self-pleasure in adulthood, followed by an important discussion on 10 potential risks you should consider to maintain a healthy approach. Let's begin with the positive update. First, it supports the well-being of the penis. The process of attaining an erection involves enhanced blood circulation into the spongy tissues of the penis, referred to as the corpora cavernosa. Consider it a type of rehabilitation for the body. This consistent physical activity supports tissue flexibility, which is essential for attaining and maintaining strong erections as one grows older. Additionally, it supports the well-being of the prostate. This is quite significant. Numerous extensive studies, notably a pivotal one from Harvard University, have established a connection between increased ejaculation frequency and a markedly reduced risk of prostate cancer development. The concept suggests that frequent ejaculation may aid in clearing out potentially harmful substances and secretions from the prostate ducts. Additionally, it enhances the pelvic floor's strength. The rhythmic contractions that take place during orgasm involve important pelvic floor muscles, such as the pubococcygeus muscle. A robust pelvic floor plays a crucial role in maintaining erectile function, managing ejaculatory control, and reducing the risk of urinary incontinence, which is often encountered by older men. Additionally, it lowers the levels of cortisol, the stress hormone. In today's demanding environment, this represents a remarkable inherent advantage. Studies indicate that experiencing orgasm results in a notable decrease in cortisol levels. Decreased cortisol levels play a crucial role in managing blood pressure and alleviating anxiety, serving as an effective means for promoting both cardiovascular health and mental wellness. Fifth, it releases a blend of uplifting neurochemicals. The experience of orgasm releases dopamine, known for its role in motivation and pleasure, along with oxytocin, frequently referred to as the bonding hormone. This natural mood enhancer fosters a sense of well-being and emotional connection, which is essential for mental health. Sixth, it supports the identification of physical concerns by oneself. Engaging in self-exploration allows for a deeper understanding of one's own body. Regular self-examination serves as a crucial method for men to identify early indicators of conditions, such as testicular cancer, penile fibrosis, or other abnormalities that may otherwise remain undetected. Seventh, it enhances the quality of sleep. Following orgasm, the secretion of hormones such as oxytocin and prolactin, along with a decrease in cortisol levels, produces a significant sedative effect. This promotes profound relaxation in the body, facilitating the transition into a restorative, deep sleep, which can often become increasingly difficult as one ages. Additionally, it improves the circulation of blood throughout the pelvic region. Masturbation enhances blood circulation across the entire pelvic area, not limited to just one aspect. This promotes the well-being of the bladder, prostate, and adjacent muscles, helping to avert complications associated with stagnation and inadequate circulation. Ninth, it can act as a technique for enhancing ejaculatory control for individuals facing challenges with premature ejaculation. Self-pleasure offers a secure and discreet environment to refine techniques such as the stop-start method. This enables a deeper comprehension of your body's signals and fosters enhanced control, which can subsequently enhance partnered intimacy. Additionally, it maintains your sexual drive and stimulates neural pathways. The brain serves as the most significant organ related to sexual function. By consistently participating in sexual imagination and tactile stimulation, you are maintaining the neural pathways linked to desire and arousal in an active state. This supports the preservation of a healthy libido and sexual responsiveness, regardless of whether you have a consistent partner. However, to gain a comprehensive understanding, it's essential to consider more than just the favorable aspects. A mindful approach is essential for maintaining well-being. Now, let's discuss the 10 possible risks or adverse effects that you should be aware of. One significant concern is the potential for social isolation. This issue arises when self-pleasure transitions from being a component of a balanced sexual life to serving as a replacement for genuine human interaction. Understanding the situation is key. Make sure this practice enhances your life rather than causing you to retreat from it. The second concern involves the potential for skin microlesions. This often occurs when the act is done with excessive force or insufficient lubrication. These small fissures can lead to discomfort, swelling, and may even serve as an entry point for infections. The solution is straightforward. Always approach with care and utilize a high-quality, water-based lubricant. The third aspect is desensitization. Consistent stimulation with identical pressure and rhythm can lead to your brain becoming accustomed to that particular sensation. This may pose challenges in reaching arousal or orgasm during intimate moments with a partner. It's essential to adjust your approach, pace, and concentration. Fourth, it may obscure the root causes of erectile dysfunction. Experiencing an erection only during masturbation and not with a partner can be concerning, and it may be easy to overlook the problem. Nonetheless, this may conceal significant underlying health issues, such as cardiovascular conditions, diabetes, or hormonal irregularities. If you observe this pattern, it is crucial to consult a medical professional. It's essential to take a moment to address the underlying causes, as this is of utmost importance. This video provides the what, but I would like to introduce a resource that delves into the why and presents an effective natural solution. This video presentation is crucial for any man who prioritizes his sexual health. It uncovers an intriguingly straightforward 7-second home solution designed to tackle what recent research indicates may be the true underlying issue behind numerous male performance challenges. This goes beyond merely covering up symptoms. This method focuses on a completely natural way to regain your youthful firmness and endurance. I highly recommend that you take the time to watch it. Use your phone's camera to scan the QR code displayed on your screen to access the video immediately. A direct link has been included in the pinned comment below this video for your convenience. Please feel free to open that link in a new tab so you can view it immediately after we conclude our discussion. Now that you have that resource available, it's essential to discuss the remaining risks you should be mindful of. The fifth risk involves nerve compression due to inadequate posture. Numerous individuals engage in self-pleasure while seated in a firm chair or bent forward, potentially putting pressure on the pudendal nerve in the pelvic region. Over time, this may result in a loss of sensation in the genital area or discomfort in the pelvic region. It is best to engage in this activity while in a relaxed and comfortable position, such as lying down with adequate support. Sixth, it may turn into a detrimental emotional coping strategy. Relying solely on masturbation to manage stress, boredom, or frustration may lead to a behavioral dependency. It's essential to possess a varied set of strategies for, say, handling your emotions, such as engaging in physical activity, practicing mindfulness, and communicating with others. The seventh aspect involves experiencing guilt and shame. Numerous men grew up influenced by strong cultural or religious prohibitions regarding self-pleasure. If these feelings continue and lead to discomfort, it may be very helpful to consult with a therapist or counselor who embraces a positive approach to sexuality, as they can assist in viewing this natural behavior in a more constructive way. The 8th condition is pelvic congestion. Infrequent ejaculation can pose risks for prostate health, but on the other hand, excessively frequent ejaculations several times a day over an extended period may result in sensations of heaviness or discomfort in the testicles and pelvic region. Finding balance is key. Pay attention to the signals your body is sending you. The 9th point addresses a possible effect on the quality of semen. This matter becomes relevant primarily when you and your partner are engaged in efforts to conceive. Although daily ejaculation does not negatively impact long-term fertility, it may lead to a temporary decrease in sperm concentration. To achieve the best quality, research indicates that a period of abstinence lasting between 2 to 5 days is recommended. Additionally, there can be a detachment from reality, frequently associated with pornography. When there is a strong dependence on extreme or unrealistic pornography, it can distort your expectations and hinder your ability to engage with a real-life partner. The essential aspect is to harmonize any visual tools with your personal creativity and recollections of genuine, impactful encounters. As you can observe, engaging in masturbation after the age of 60 isn't merely classified as good or bad. It serves as an instrument. Just as with any instrument, the manner in which it is utilized dictates the outcome. The essential element is invariably awareness. When approached with mindfulness, consideration for your body, and balance, it can serve as a remarkable and beneficial partner for your well-being and energy. I trust this discussion provided valuable insights. I would truly appreciate your thoughts on this matter. What stood out to you the most today? Feel free to share your thoughts in the comments section below. Let's keep this vital conversation going together. If you appreciated this video, kindly give it a thumbs up and subscribe for more clear, evidence-based insights on adult health matters. Be sure to activate that notification bell so you can stay updated on our upcoming discussions. Take care of your health, and I look forward to our next video together.